Let's begin by talking about health. Primarily, what health is, how health is lost, how health is achieved, and how to maintain health. You may have reached out to me to help find a solution to a current symptom that is affecting your quality of life and preventing you from expressing your true potential. And that's okay. I'm honored that you chose me to help you find a resolution to your health problem. However, is it the symptom that is the problem? Most people with low back pain, for example, resolve their pain in about a month. It's what we call the natural history of back pain. Most people suffering from uncomplicated low back pain will generally feel better after a month without really doing anything about it. Some choose to take what I call symptom extinguishers, also known as medications, to ease their pain. While I understand that a person taking pain medication to cover up their symptom wishes to instantly feel better, they don't necessarily heal better. They're merely covering up the signal their body gave them to pay attention. Now, there is a time and place for medication and medicine, and usually that is when we're in a state of distress or experiencing a medical emergency. Our medical system can help save our life in an emergency. However, relying on an emergency or sick care model to help manage our health issues is problematic. Medications and medical procedures carry a degree of risk, not to mention side effects and misdiagnoses. They are meant to address a dire situation, but they fail to manage conditions adequately over the long term. Feeling better is important, but it does not necessarily mean you are healthy. I assure you, many people felt perfectly fine the day before they suffered their first heart attack. It is important to understand that the body can be in a state of dis-ease or dysfunction, meaning lack of function, well before any symptom is felt. Therefore, health can't simply be when you're feeling good. Feeling good does not always relate to health. So, what is health? Health is when the body is in a state of optimal function and healing. The body has an innate ability to heal itself. This is a principle I believe people have dismissed or neglected in healthcare. The key is to position your body for optimal function and healing. What is responsible for all function and healing in your body is the nervous system. This is the master system of the body. Signals flow from the brain down the spinal cord and exit through the nerves, giving life to every cell, organ, and tissue in the body. When I say the nervous system is the master system, I mean that nothing functions without input from the nervous system. It is vital for all processes in the body, not only the sensation of pain. There are several parts to the spine that you need to be aware of. They are called the cervical, thoracic, and lumbar regions. Each region supplies different parts of the body. The cervical or neck nerves, I would argue, are the most important considering the signals sent from them go to almost every part of the body. Nerves from this region supply the head, eyes, ears, nose, throat, thyroid, sinuses, and descend down to supply your shoulders and hands. Irritation of these nerves can produce symptoms arising from any of the body parts that I mentioned. The thoracic or upper back supply two key organs, your heart and lungs. The lumbar or lower back supplies life to the lower abdominal organs, sex organs, and then they descend down into the hips, knees, and feet. Often people complain about sciatica or nerve pain along the pathway of the sciatic nerve. This is misunderstood as a condition when it is merely a symptom of a more complex issue. How do we lose health? For a very small number of population, poor health can be a result of genes. Please understand that this is rare. Our genes do not necessarily dictate whether we will develop certain conditions and diseases, which is great news. Studies have demonstrated that even cancer genes can be turned off when healthy lifestyle behaviors are practiced. Let's address the obvious reasons we get sick. Stress. To simplify, stress can be divided into three categories: physical stresses, chemical stresses, and mental emotional stresses. Physical stresses, such as traumatic births, falls, extreme sport activity, improper exercising, occupational hazards, poor ergonomics, motor vehicle collisions, increased or improper mobile and tablet use, spinal misalignments, or poor spinal structure are just examples of some physical stresses. Chemical stresses can include medications, unhealthy food and drink, increased alcohol consumption, smoking, illicit drug use, toxic skin products, cleaning products, natural environment, the work environment, among others. Mental emotional stresses include negativity, ingratitude, toxic people, poor attitude, financial worries, depression, anxiety, social media, etc. In order to understand how poor spinal function and structure affects your health negatively, one must know what the ideal spinal alignment and structure are. Your spine must appear straight when observed from the front and have 3 flowing curves when viewed from the side. Misalignment is called subluxation. Subluxations rob the body of proper spinal health and function. As we see in this video, when the spine shifts out of alignment, increased physical stresses are placed on the bones, discs, joints, and potentially nerves. Over time, as this stress builds in the body, the spine physically breaks down and signs begin to appear on X-ray. It is for this reason that spinal X-rays are an important part of any chiropractic practice. It allows us to determine the extent of the damage, how long the process has been taking place, and more importantly, how to correct it to reverse or halt the progression. It is also used to determine if you're a suitable candidate for corrective chiropractic care. By restoring the alignment, you ensure that the spine functions optimally. It's important to note also that healing requires time. There is a certain degree of effort that you need to exercise to correct a spinal problem. Depending on the severity of the problem, it may take up to a year or more to stabilize the spine. Yes, it does take work. Most individuals will start receiving care multiple times a week until progress exams show signs of improvement. Spinal exercises and stretches will be introduced to help you self-manage the condition at home and to complement your spinal adjustments. We then decrease the frequency of your care when an appropriate level of stability is achieved. Some people will require a block of care, while others may require 2 or more. Each block is broken into a number of adjustments, which include exercise traction units and assessments. Your care program requires time and need to prioritizing your health, especially if you've neglected it for too long, and a financial investment. Depending on the number of blocks of care your condition requires, it may cost anywhere between $1,500 to $3,000. Now I know what you're thinking. For some individuals, that may shock them initially, especially since they rely on their insurance. While you may have insurance, it's very possible that they will not cover all your chiropractic care. I have to stress the following point. We don't base our recommendations for care based on what your insurance pays. If after seeing your results you insist on using only your insurance, then corrective care is not what you will receive. So what is correction? Once we've determined what's responsible for the dysfunction, we need to establish an optimal treatment program that corrects it. Now, spinal correction is achieved when a chiropractor uses a gentle, specialized technique called an adjustment that involves restoring function to a part of the spine that has become dysfunctional. Some adjustments, not always, are associated with an audible pop, similar to the sound of cracking your knuckles. But not to worry, this sound is what you hear when there's an exchange of gases within the joint space. Please note that some soreness may be felt after the adjustment, but that's completely normal. To help families afford care, we have several payment arrangements to assist you, whether it be paying monthly or all in advance, which discounts your care by 10%. If you have a spouse or a family member or loved one that you think should also get their spine checked by us, kindly let my staff know and they will provide them with an appointment to receive a complimentary assessment on us. Should your family member from the same household require care as well, we will be happy to discount their care from the original fee. Please keep in mind that this is not a forever deal and is available for 1 week. For example, if after a week someone still wishes to come in for an assessment in the office, they are more than welcome to, but the regular fee of $150 applies. So how is health maintained? After achieving a certain level of stability, it is important to maintain your results. Earlier I mentioned the 3 stresses that destroy health. The answer is logical and simple. First, avoid bad behaviors. Introduce good ones. Take only the essential supplements that you need to complement your care, such as probiotics, omega fatty acids, and vitamin D to help support your healing. And more importantly, take care of your spine once it stabilizes. After your initial program is complete, we will reassess with a new x-ray of the misaligned segments and propose a maintenance program which will be either weekly or every 2 weeks. Like with any healthy behavior, you should maintain it to continue enjoying its benefits. What happens when we stop eating well and start turning to fast food and other poor lifestyle habits? What happens when we stop moving and start becoming more sedentary? Likewise, what happens when we stop taking care of our spine, which houses the master system of the body? I think the answer is clear. I want to thank you for listening to your doctor's report. If you have any questions, kindly reach out to us.